Tuberculosis, often simply called TB, is a disease that has plagued humanity for centuries. It's caused by a bacterium known as Mycobacterium tuberculosis. This isn't a new threat, it's an ancient adversary that we are still fighting today. What makes it so formidable is its primary target, the lungs. When these bacteria take hold, they can cause serious damage, making it difficult to breathe and compromising one of the body's most vital functions. While TB most commonly affects the lungs, it's crucial to understand that it can also attack other parts of the body, including the kidney spine and even the brain. The global impact of tuberculosis cannot be overstated. It remains one of the world's deadliest infectious diseases, claiming millions of lives each year and causing suffering for many more. This isn't just a problem for distant countries. It is a global health issue that affects communities everywhere, including right here at home. The sheer persistence of TB in the modern era, despite our medical advancements, is a stark reminder that we cannot become complacent. Awareness and education are our first lines of defense, empowering individuals with the knowledge they need to protect themselves and their loved ones from this persistent bacterial invader. Understanding the difference between the two forms of TB infection is essential for grasping the full picture. Many people who are exposed to the bacteria develop what is called latent TB infection. In this state, the bacteria live in the body without making the person sick. They are not contagious and do not show any symptoms. However, the bacteria can become active later in life, leading to active TB disease. This is the stage where a person feels sick, experiences symptoms, and can spread the bacteria to others. Recognizing this distinction is key to both prevention and control strategies worldwide. This is why we are talking about it today, on September 17, 2025. This isn't just an abstract medical topic, it's a real and present danger that requires our collective attention. By shining a spotlight on tuberculosis, we aim to demystify the disease and dismantle the stigma that can often surround it. Knowledge is power. When we understand what TB is, how it spreads, and how it can be treated, we take the first critical step toward building a healthier world. We must confront this challenge head-on, armed with facts and a commitment to public health for everyone, everywhere. The transmission of tuberculosis is surprisingly straightforward, yet it's this simplicity that makes it so effective and widespread. The bacteria are airborne. This means they travel through the air from one person to another. When someone with active TB disease in their lungs or throat coughs, sneezes, speaks, or even sings, they release tiny droplets containing the bacteria into the air. These microscopic particles can then be inhaled by a person nearby, allowing the bacteria to find a new host and begin the cycle of infection all over again. It's an invisible threat, passed through the very air we share. It's important to clarify that TB is not spread through casual contact. You cannot get it from shaking someone's hand, sharing food or drink, touching bed linens, or sitting on a toilet seat. The risk comes from prolonged, close contact with an individual who has an active, infectious case of the disease. This is why transmission is more common among family members, close friends, and people who live or work together in confined spaces for extended periods. Places like crowded households, shelters, and correctional facilities can become environments where the bacteria can spread more easily if proper precautions are not taken. The source of the disease is always a person with an active TB infection. The bacteria do not live on surfaces for long periods or come from animals in most cases. The chain of infection is human to human. Once inhaled, the Mycobacterium tuberculosis bacteria settle in the lungs, where they can begin to multiply. The body's immune system will immediately launch a response to fight them off. In many healthy individuals, the immune system is strong enough to contain the bacteria, walling them off in tiny capsules. This leads to the latent TB infection we discussed earlier. The person is infected but not sick. However, if the immune system is weakened, it may not be able to stop the bacteria from growing. Individuals with compromised immune systems are at much higher risk. Recognizing the symptoms of active TB disease is absolutely critical for early diagnosis and treatment, which can save lives and prevent further spread. Because TB most often grows in the lungs, many hallmark signs are respiratory. One of the most prominent symptoms is a bad cough that lasts 3 weeks or longer. This isn't just any cough. It's a deep, ongoing cough that won't go away with typical remedies. Sometimes the cough comes with chest pain, or in advanced cases, coughing up blood or sputum from deep in the lungs. Beyond the chest, TB causes systemic symptoms, showing the body is fighting a serious infection. profound weakness fatigue that makes daily tasks hard, loss of appetite leading to unintentional weight loss. These symptoms can come on gradually and are often dismissed, but persistence is a red flag. Fevers, night sweats, chills. Low-grade persistent fever leaves a person feeling unwell. Night sweats can drench pajamas and sheets. Chills may accompany these episodes. This trio, fever, night sweats, and chills, is the immune system working overtime. It should never be ignored, especially with a chronic cough. If you or someone you know has a persistent cough, chest pain, weight loss, fatigue, fever, or night sweats, see a doctor immediately. Do not wait for symptoms to worsen. Early detection is the most powerful tool against TB. A provider can run tests, skin test, blood test, chest x-ray. Listening to your body and seeking care promptly is an act of community care. Preventing the spread of tuberculosis begins with a foundational strategy: identifying and treating people with active TB disease as quickly as possible. This is the most effective way to break the chain of transmission. When a person with active TB is put on the correct medication, they typically become non-infectious within a few weeks. This is why public health programs that focus on rapid diagnosis and accessible treatment are so crucial. By treating the individual, we are also protecting the entire community. Health systems must be equipped to test people who show symptoms, trace close contacts to check for infection. For those diagnosed with latent TB infection, preventive therapy is a powerful tool. It usually involves taking medication for a shorter period, typically a few months. The goal: eliminate dormant bacteria before they become active, especially important for people with higher risk factors like a weakened immune system. Think of it as a proactive strike against the bacteria. If your doctor recommends treatment for latent TB, follow that advice for long-term health. Simple environmental measures can greatly reduce transmission. TB spreads through the air in enclosed spaces. Improving ventilation is key. Well-ventilated room with open windows, opening windows, using fans. These actions help disperse airborne droplets and lower inhalation risk. Important in crowded settings: hospitals, clinics, schools, public gathering places. Good ventilation is a low-cost intervention protecting against many airborne illnesses, including TB. Maintain a strong immune system, your natural defense. Healthy lifestyle matters. Eating a balanced diet rich in vitamins and nutrients. Getting regular physical exercise. Ensuring you get enough sleep. Avoid excessive alcohol. Quit smoking. Taking care of overall health builds a personal shield against TB exposure. The good news is that tuberculosis is a curable disease. For decades, we have had effective antibiotic medications that can kill the bacteria and lead to a full recovery. The standard treatment for active TB disease involves taking a specific combination of several antibiotics for a period of 6 to 9 months. It is absolutely essential that the patient takes all of their medications exactly as prescribed by their doctor for the entire duration of the course. This rigorous regimen is necessary to ensure that all of the bacteria are eliminated from the body, including any that may be slow-growing or resistant. One of the biggest challenges in treating TB is adherence to this long-term medication plan. Stopping treatment too soon, not taking the pills regularly, can be incredibly dangerous. It can lead to a relapse of the disease, and even worse, it can cause the surviving bacteria to develop resistance to the drugs. This creates drug-resistant TB, or DRTB, which is much harder and more expensive to treat, requiring longer courses of more toxic medications. To combat this, many public health programs use directly observed therapy, or DOT. A healthcare worker or trained volunteer watches the patient take their medicine each day, providing support and ensuring completion. For those with drug-resistant forms of TB, the journey is more difficult, but there is still hope. Treatment for DRTB can last for up to 2 years and involves second-line drugs that can have more significant side effects. However, ongoing research is constantly leading to new and improved treatment regimens that are shorter, more effective, and easier for patients to tolerate. The global health community is committed to finding better solutions. Ultimately, beating TB is a partnership between the patient and their healthcare team. For more trusted health information, subscribe to Happy Health 10.